I'd like to welcome you to BeMoreNews.com, the news before the news, where we uncover the truth. We're here at the White House with Dr. Kevin Fenton, the director of the Center for Disease Control. How are you, sir?
I'm very well, thank you.
Good. What was today's discussion all about?
Well, today was an amazing day which really focused on HIV and black men. And we had open and honest conversations about the staggering HIV epidemic among black men in the United States, and really began to talk about the factors which are driving the epidemic in black men and what we as a community need to be doing to get ahead and to bring this epidemic to an end.
Well, some of the interesting facets that were brought out were racism, classism, the fact that now the discussion is between heterosexual males and homosexual males in churches, across church lines, across religious lines. What did you hear today?
Well, I heard a number of things. The first is that we have got to understand what is driving the epidemic among black men in the United States today. And we heard throughout the presentations that it's not just risk behaviors, but we heard about the high rates of sexually transmitted diseases. We heard about some of the social factors which are driving the epidemic: poverty, racism, homophobia, poor access to healthcare services. Those are factors which are driving the epidemic.
Fear.
We also heard about stigma and discrimination and fear as factors which are also preventing men from having open conversations about HIV and about getting an HIV test and accessing services if they're HIV positive. But we also heard about some of the strategies for hope. How do we bring this epidemic to an end? And what I am taking away is that it really requires us to have open and honest conversations within ourselves as black men, within women in our community, and within the wider community as a whole. It has to be everybody's issue if we're going to get ahead of this and we're going to bring this epidemic to an end.
Now, in a day and time when we have a black president, I come from Baltimore, state of Maryland, 30% black state, 65% black city. We have more black politicians than ever before. But at the same time, I'm not hearing HIV and AIDS at the forefront of their agenda. It seems in order to get reelected, we have to say other buzzwords: crime and safety, education. But in an era, 2010, ought this not be falling first off of the lips, or at least among the first words off of the lips of any black politician, particularly in a majority black jurisdiction? I mean, that's just my bias.
Well, we have to be honest. We have seen an unprecedented focus on the domestic HIV epidemic with this administration. The president has made it absolutely clear that HIV is one of his domestic priorities. He's committed to doing a national HIV/AIDS strategy, and that's going to be released shortly. And in the year and a half since the administration has come into being, we've seen tremendous advances in policy for HIV, with improvements in investments in HIV prevention. We've seen expansion in HIV treatment and care services, and expansion in research here in the United States. So I don't think it's correct to say that this administration has not been focusing on HIV/AIDS.
No, not this administration.
There is truly a renewed focus on HIV in the United States, and we need to take full advantage of that.
No, I mean on the state and city levels.
So at the state and city levels, what we're seeing are a number of things happening at the same time. The economic crisis is having a tremendous impact on public health and preventive services across the country, because states are having fewer and fewer resources to invest not only in HIV, but in chronic disease care, in injury prevention, and other types of activities as well. So what is critically important now is that we think very effectively about the federal resources which are available for HIV prevention, and that we're working with state and local health departments to ensure that they're held accountable, and we're holding ourselves accountable for using resources as effectively as possible. And we need to bring new partners to the table as well.
Like who?
So we need to look at our business sector, we need to look at the non-profit sector, other community organizations that can bring additional resources to the fight against HIV at the local level. Remember that success against HIV is going to occur at the grassroots level. We need to ensure that the resources are reaching the grassroots and that we're holding each other accountable for success.
I don't know if this is a question as much as it is a comment. What I've seen, particularly in Baltimore, is that those nonprofits, the leaders who have the street credibility. Their organizations seem dwarfed compared to the larger, richer, say the white nonprofits, where they have a ton of money, a much stronger infrastructure. It seems the ones who are grassroots, who are down on the ground in the trenches, they're not able to survive in the midst of a recession.
That's right, and it is one of the casualties of the global economic crisis, that there's fewer resources to go around. And so we need to look at the organizations and the structures which are making the largest impact on the epidemics. The reality is that we need everyone to be a part of this fight, and grassroots organizations have to partner effectively with the state and local governments, and they have to partner effectively with the federal government and with other partners. We have to do this together. We cannot do it on our own.
Good deal. Any final thoughts, sir?
As we reflect on HIV in black men, what I'm taking away from this message is that there is a journey that we're on. And we can't see HIV on its own. That HIV and the epidemic in black men is occurring within a wider set of epidemics on other sexually transmitted diseases. But that's occurring within wider differences in the community with chronic diseases, with issues related to access to healthcare services, with issues related to poor educational opportunities, with issues related to high rates of incarceration. So if we are really going to be addressing this epidemic in our community as black men, we need to think about everything from the individual approach to what communities should be doing and what we as a society should be doing to bring this epidemic to an end. We need a comprehensive approach to prevention, and we need to sustain our efforts over time. This is not a sprint, it is a marathon, and we need each other along that way.
Good deal. We appreciate you, Dr. Kevin Fenton of the CDC, and we appreciate the efforts put forth by the Obama administration in making HIV a priority. Keep watching BeMoreNews.com, the news before the news, where we uncover the truth.